Hello there. Welcome to the clinic. So, it's my understanding you've been experiencing flashing lights and floaters in your vision, and we've managed to get you in today. So, when did the flashing lights and floaters begin? Only this morning, okay. Did the flashing lights and floaters come together at the same time, or was it one before the other? Okay, and just show me where in the vision you are seeing these flashing lights. On your right side, okay. And they're present at the moment, as well as the floaters. Now, has anything like this ever happened before? Have you recently experienced any physical trauma, particularly to the head? Any blunt force? Been hit with a ball, football, anything like that? Have you been participating in any combat sports? Okay, any history of migraines? Have you had any eye surgery in the past? So you've never been to an eye hospital? Any double vision? Is there any family history of retinal tears or retinal detachment, do you know? So this is the first time we've seen you. I've got your prescription here. I can see that you're moderately myopic. Okay, are you diabetic at all? And you don't have Marfan syndrome? Okay, so based on the information given, I'm going to perform a bilateral dilation, which essentially means popping some eye drops in your eyes that are going to dilate the pupils and allow me to see the back of the eyes in a lot more detail. The drops will leave you blurry for a few hours afterwards, so please no driving, no cooking, and no operating any machinery, if that's okay with you. Certainly no driving. So I'll make a note that I've discussed that with you and you're happy for me to dilate your eyes today. Right, before we get to dilation, there are a few tests we need to perform. First one is vision, so I'll just cover your left eye with the palm of the left hand, please. So straight ahead you'll see that there's a vision chart. I want you to read down the chart as low as possible, please, saying the letters out loud. Okay, just have a go with the row below that one, please. Okay, thank you. Cover the other eye with the other hand. And again, just have a read down on the letter chart as far as you can. Okay, let's just turn the room lights down and perform some additional tests. Okay, you'll see at the bottom of the letter chart there is a spotlight. Keep looking at the spotlight. I'm just going to check your pupils this light might be a little bit bright. Keep looking straight off into the distance. Okay, please look towards me. I'm just going to shine the light from the side there. That's just checking the depth of the eye at the edge. You don't need to say anything, just looking at me. Thank you. That looks fine. I'm not sure whether there is a problem with the right pupil there, possibly a relative afferent pupillary defect. Don't worry about that. We'll perform some additional tests in a moment. And shadow test. Okay, we need to move on to eye pressures now, so I have to pop a little drop of anaesthetic into your eyes. It's going to smart ever so slightly. Okay, I'm going to pop the lidocaine fluorescein into the eyes now. Okay, so they obviously have a little bit of yellow dye incorporated too. Not to worry. Your job is to look up to the ceiling, please. Okay, give that a moment. Okay, and look up again, one for your left eye. Okay, let me set up the tonometer. So this is how we check your eye pressures. Want to see if there's any disparity between the two. Okay, has the stinging worn off? Excellent. So the way it works, this probe is going to make delicate contact with the front of your eye, but you're not going to feel any pain at all. Contact will be light and very quick. So please keep both eyes open, breathe normally, and keep looking off into the distance if possible, please. Are you ready? Right, what do we have there? We have 12 mmHg, okay. Let's see if we can do your left eye next. Okay, try and look off into the distance again, please. Possible. That's it, just over my left. Okay, and that's it, simple as that. 17 for the left, so there is a disparity of 5 mmHg there, okay. That's tonometry completed. Okay, let's take some notes. is I'm going to pop your dilation drops in now. 2 lots, or should I say 2 different drops. 1 drop in each eye. First drop will be tropicamide. Just bear with me, please. Full dilation will take about 20 to 30 minutes. So if you're ready, look up to the ceiling. Let's drop it in. The right. Continue looking up and the left. Give you a few moments and I'll prepare the second drop. Phenylephrine. Look up again, please. Very well done. So, tropicamide, 1%. Batch and expiry dates. And phenylephrine, 2.5%, same time. Batch number and expiry date. Lovely, so the drops are in. I'm going to ask you to take a seat in the waiting area and I'll come and check on you in about 20 minutes. Thank you. Okay, I'm going to examine your eyes with the slit lamp. Please come forward, place the chin on the chin rest and your head against the top at all times. Please try and look towards my right here, or in this direction to begin with. I'm just going to make a few checks before looking with a special lens. Yes, it appears there is a little bit of evidence of Schaefer's sign, otherwise known as tobacco dust. Just make it a little bit brighter here. So that's not a good sign. We're looking for signs of retinal tear or detachment. Okay, now I'm going to hold this lens just in front of the eye for now. Keep looking in this direction until I tell you otherwise, please. That's it. We'll have a look at the ocular structures and I'll move on to the retina. Sorry if it's a little bit bright. Okay, please look up to the ceiling next. Okay, look to your right hand side. Just look up and right next. Okay, up and left. Okay, directly to your left hand side, please. Just a bit more out to your left. You can see that we have what looks like a retinal tear in your right eye, which isn't good, but hopefully we can get that treated. Okay, let's continue. Look down and right, please. Straight down to the floor now. And down and left. Yep, so maybe the jelly of the eye has just torn the retina as it's pulled away at it, leaving this sort of horseshoe shaped tear, which we'll need looking at the eye hospital. Okay, give yourself a moment. We'll have a look at your left eye next. Okay, if you're ready, try and look towards my left ear or in this area here to begin with, please. Okay, yep, the anterior vitreous looks clear. Anterior chamber is fine. It's got a little brighter there, sorry. Alright, let's have a look with the Volk lens again. Just in this area again, please, just to start with. There we go. Optic nerve and macula, that's fine. Just looking up to the ceiling. Okay, up and left. Okay, and up and right, please. Okay, directly to the right hand side as far as you can, please. Okay, and now down and right. Okay, straight down. And down and left. And directly to your left hand side as far as you can. almost there now. Right, okay. Sit back and relax and we'll have a little chat. So following investigation, it seems that you've experienced a spontaneous retinal tear in the nasal portion of your right eye. Don't worry too much. I am going to refer you to the eye hospital to have the retinal tear sealed, possibly with a laser, but let's see what the ophthalmologist says when you get to the hospital. So, I'm going to do your referral now. Because of the type of tear, this horseshoe type retinal tear, I'm going to send you to the eye hospital with a referral in hand, because it is quite serious. If it is left, it could become a full-blown retinal detachment, and that is very serious. There is a strong risk of losing your sight if your retina detaches. So let's deal with the tear and get it treated. So let me write the referral for you here. So she's and Otis since this morning, approximately 10 AM. Floaters, then flashes. No physical trauma. No medication. No general health issues. Marfan syndrome. First time this has happened. We have no family history of any retinal issues that we know of. Please see patient. Right eye. Horseshoe retinal tear. Right eye nasal periphery with Schaefer's sign. Okay, I will print that off for you to go to the eye hospital today. I'll obviously need somebody to drive you there. Okay, so with this referral, go straight to the eye hospital. Let's get you treated, and then please let me know the outcome and what the hospital say and do afterwards, please. Okay, so hopefully see you soon. Bye for now.